Good morning, everyone, and thank you for attending our webinar this morning on the Allied Member Connection. My name is Gary Ashley. I'm Executive Vice President of Allied National, your administrator for your health plan, and we also have with us today a special guest, Catherine Rowe from Benovate, who will give us some demonstrations on the portal as we talk about it here. A few housekeeping items before we get started. Everyone is signed in and muted. If you have dialed into the conference call, your phone is muted. If you have a microphone and you're listening over the internet connection, you're also muted. That's probably the easiest way we can keep down the noise in the background and everything. What we'll do is at the end of the webinar, we'll start answering your questions, and rather than doing this through the phone system, your GoToWebinar screen actually has a question panel you can use. Someone's already started me off with a question that I answered just a few minutes ago, and we'll take your questions at the end of the webinar. So let's go ahead and jump in and get started here and talk a little bit about Allied Member Connection, which is today's topic. Give me a second to get our show started. So we're going to talk about Allied Member Connection, and you've probably seen a lot of communication from us over the past few months about this. We'll get into what's in it for you as a participant and for your employee members that are part of your health plan. Benovate will jump on and talk about the actual technology and demonstrate the platform. So if you haven't signed into the portal before, you can take a look at it and see what it's all about and get a better idea of how to use it and how to promote it to your employees. What is Allied Member Connection and how did all of this start for us? Allied Member Connection is meant to be the online starting point for members to access everything about the health plan you have with Allied National. It's a one-stop resource for you at the address that's showing on your screen right now, member.alliednational.com. That's the only web address a member really needs to know to access everything about their health plan, everything about the wellness program, and the other benefits that are part of this program that we're going to get into here. What it really started out, though, was an effort to fulfill everyone's desire to bring a wellness program into your health plan. And it evolved into a little bit more than that, actually a lot more than that for you when we realized the capabilities that the Member Connection powered by Benovate portal really brought to you. So what is a wellness program here? There's a lot of different definitions, so let me just kind of go into what I view as the key elements of a wellness program, which is the basis of the Member Connection portal for you and what it brings to you and all of the members. The first thing is education. We're trying to bring information and enlightenment, I guess, to your members and to yourselves about aspects of both your health plan, the benefits you have, as well as general wellness topics. Now, everyone's been exposed to wellness-type education programs in some way, shape, or form, whether that's through smoking cessation programs, weight loss programs. That's the typical education you see out there. And really, if a wellness program just stops at education, it's kind of a feel-good exercise that really doesn't do anyone any good, and it doesn't really have that much impact. So to go beyond education, the next level of a wellness program is what I call assessment or a health risk assessment, and that's getting to know who you are as a member and what your personal issues are for your health. Are you a smoker? Are you overweight? Are you diabetic, hypertensive? All of those kinds of things go into assessing the risks to your health and your life, and you've probably been in wellness programs through other health plans before that do something called a health risk assessment, and we do that also. But the difference is we go beyond just doing the assessment. My own personal experience with wellness programs has been taking a health risk assessment and getting a little email canned response back from the assessor saying, yeah, I'm a little bit overweight, yeah, I shouldn't smoke the cigar on the patio every evening, change it. But it doesn't give me any help to make those changes in my life. So we've upped that by bringing in the next couple of levels of a wellness program. And the next level in my mind is engagement. And that's getting our members, getting you involved in some sort of a system or program that keeps you coming back for more. It keeps you coming back looking for more information, more help, more guidance, that it engages you in some way that makes you want to come back. And when you see the Benovate demonstration a little bit later here, you'll understand some of the features we've put into this program and some of the power of the Benovate program to keep you and your employees engaged in the program to gain some benefit from it. Where a typical wellness program really fails, though, is both at the engagement level and at this next level, which is what I call intervention. And for us, this is actually health coaching. It's actually getting a member one-on-one involved with a health professional who can help them through the risks they have in their health and in their life, whether it's stress, whether it's learning about the adult onset diabetes for which they were just diagnosed, or their hypertension. All of these things can make a giant difference if someone just has someone they can work with. Many times, if you have a primary care physician, that really should be their role, but you'll find many times that the primary care physician just doesn't give you the time you need to understand what's going on with your health. And all of this really is summed up by this buzz phrase that's in the healthcare industry, which is true population health management. And what that really means is trying to improve the health of everyone in your group. Now, the dirty little secret of population health management out there is many wellness programs exist that have carrot and stick approaches to engagement to get people into your wellness program. And what really happens is you don't really improve the health of your particular population, you change your population. The people who enjoy these wellness programs typically are the people who are predisposed to good health already. They're the ones that go out and run a couple of miles every day. But what happens is if you put carrot and stick approaches into your engagement, and really I mean sticks, where you say, I won't contribute the last $100 of your health plan unless you go through this program, or your deductible will be cut in half if you go through this program. The people who truly can benefit the most from being in a wellness program often don't respond well to that approach, and they leave your company. You'll lose employees you might really want to retain because they don't respond well to that type of approach. And at that point, population health management becomes changing a population. And what we really are trying to accomplish here in a good wellness program is to improve the health of the people who are in your company right now. So let's go beyond just the wellness aspects of member connection here. I talked a little bit about engagement, and part of our strategy for engagement is to make this about more than just a wellness program for you and your employees. The member connection portal is your one-stop access into information about your benefits. Many of you have probably registered for an account, if not through member connection, directly through the Allied Public website into what we call our web self-service. And there you can find out information about your benefits. You can find out information about your specific claims. Well, We've simplified this process now, and instead of having multiple accounts, a member connection account, an allied self-service account, we want everyone going through member connection, and member connection and the Benovate portal serves as the single sign-on source for everything you need to access about your health plan here. Now, I use this phrase, single sign-on, and basically what that means is once you've signed on into member connection, you're considered signed on to all of the other aspects and secure accounts that are part of that. And a good example of this that you probably have run into on the internet before is if you go to some website that wants you to register, one of the options very often is it says register using your Facebook account. Facebook is probably the biggest source on the internet for what we call single sign-on. If you're registered through Facebook, they serve as the sign-on authority for all the other secure stuff you can access through the internet. And that works too for the allied programs available through you. The other items that are available within the member connection, this isn't a complete list, but it gives you some of the ideas for things available with your health plan. And I'll ask you straight out, are you aware of all of the other things we try to make available for you to make it easier for you to use your benefits and to expand your benefits in different ways to make it easier for you to obtain healthcare through your providers? The first one is something that is rolling out kind of as we speak here. The total integration into the member connection portal should be just about done by the end of this month. And this is Amwell, a company called American Well, who is a telemedicine provider. Now, you're probably familiar with Ask a Nurse, Dial a Doc type things. Amwell takes it a step further, and they provide either internet access from your computer, or they provide a phone app for you and your employees to access providers live in real time, and it's a benefit of your health plan. It is, if you have a non-HSA plan, it is a copay-free way to gain access to a doctor. We'll waive your doctor's office copay if you have that on your health plan. For those who have health savings account plans where you're not allowed to get first dollar benefits like that, we'll actually credit any charges from the Amwell providers to your deductible at a greatly reduced cost. And just to give you an example, the typical office visit encounter you might have with your primary care physician, a typical claim charge is about $150, and that involves doctor's office visits and any procedures or tests they may do there. A typical Amwell encounter is going to run 25% of that cost. So not only is it much more inexpensive for you and your members, it's really convenient for your members. And using the live video of a phone app is just tremendous convenience, and doctors can even ask you to take a picture of your throat. If you have a child with strep throat, for example, they can take a quick look down their throat using the phone app. It's really quite remarkable what they can do. Now, one of the reasons phone apps is becoming so big rather than just dialing on your on the telephone is, one, the video access, but also just the ubiquitousness of smartphones in people's hands. We've had vendors tell us that as many as 2/3 of adults in the United States have a smartphone in their hand every day. So the majority of your employees, maybe they don't all have computer access and internet access, but I'd be willing to bet the majority of them have a smartphone available to them. So that's one of the big features coming inside the member connection right now. But the portal is also there to teach you and your members how to access and use some of the other benefits that are available in the plan. We have a program called Bridge Health for people who need surgery in a non-acute setting, meaning a surgery they can pre-plan, such as a joint replacement is a very common example like this. Bridge Health is a Centers of Excellence program that will actually work with you to put you into the appropriate setting both for quality of care and cost of care issues, as well as paying you a cash incentive to help you with the Bridge Health experience. Maybe there's travel you'll need to do for that to get to that center of excellence. Bridge Health will help pay you to do that, as well as a companion to go along with you. The other couple of benefits up there on their screen, US Med. Without going into too much detail, adult onset diabetes is huge problem in this country right now. US Med is a provider of diabetic services and will actually provide free glucose testing monitors connected to their systems so that live real-time tracking of a member's blood glucose happens, and it will help educate members both on how to handle their diabetes as well as monitor for emergency situations when blood glucose is either off the charts or beneath the charts in some situations, and help maintain members' health and keep them away from crisis situations. We also have a program called Abeniti, which is an internet purchasing discount program that provides a wide variety of discounts for everything from travel services to movie tickets to the basic things that many of us are now buying on the internet. I actually use it quite often myself to provide movie tickets because there's some really good discounts at my local theater. So these are some of the things that are available through Member Connection, and the Benovate portal will help educate your members on the availability of these things. And once you see the demonstration, it'll hopefully become much more clear to you how this education process happens within Member Connection and how it also helps to keep people engaged and coming back into the portal and being exposed to some of the wellness features. Allied Member Connection also is a good portal access to our public website, which is always available. Members don't need to go through Member Connection to get to the public website, what we call our Allied National Member homepage, but going through Member Connection provides just another avenue for them to get to that and quickly find the kinds of things they need. The top two reasons people come into our public website, covered members do, is to find providers. If they have a PPO plan, you're always looking for, is this provider in my network? Is there a provider near me? Which facility should I go to? The other reason is to look up plan and benefit information, and most specifically about prescription drug information. It's a very big deal these days for members to be aware of the prescription drugs they're taking. Are they brand name? Are they generic? What's the most cost-effective way for me to take prescription drugs here? And so there's plenty of information on our website about that. And the website also has a lot of information about the special benefits that I was just talking about. Now again, the big issue with Member Connection, the thing we're really working hard to accomplish is engagement. And I've talked about that as being one of the real pillars of a good wellness program, is how do we keep people engaged? How do we keep them coming back? Now, I don't want to say we're tricking people to come back, but what we're doing is we're providing a whole host of other things besides just wellness programs to keep people engaged inside of Member Connection here. It's more than just wellness, but wellness really is the focus and the reason for the existence of the Member Connection here. So how do we keep them engaged? When you see the demonstration, you'll see some of the what are called the gamification things that happen inside the website to keep members entertained, engaged, learning as they go, and at the same time we're learning about you while you're in that system. One of the big ways here is there's actually rewards for members participating inside the Member Connection system. They can earn dollars through Amazon gift cards for participating in the activities that are in the system. Now, some of the activities are as simple as learning how to navigate through the Member Connection. That's really some of the first things that are thrown at them. But the biggest rewards come for participating in wellness-related activities. And we naturally have a health risk assessment that we wish members to do, but we have other activities that you can engage in, participating in both wellness as well as educational opportunities on how best to use your health plan here. Okay, what I'd like to do now is turn our program over to Catherine Rowe of Benovate. Give me just a moment while we shift here a little bit and make her the presenter. Catherine is Health Program Manager at Benovate. She's a Master's of Public Health, really knows these issues well. Catherine's going to get into a little bit about Benovate themselves and demonstrate the program here. Give us just a second to get everything up on screen with Catherine and get going.
Hey, thank you, Gary, for that introduction. Can you see my screen?
You are up and running, Kat.
Okay, excellent. So Gary did a really great job of giving a little introduction into why we are partnering with Allied, but I'm just going to give a little background in who Benovate is and what we're doing, why we're doing it, and then I'll go into a little demo of the platform. So Benovate is essentially the engine behind the Allied Member Connection, which we're doing by providing the technology to customize each individual member's health interests and needs and providing rewards for those everyday wins by participating in those healthy activities, and then also giving access to care for that long-term health management. Now we have 4 main things that we're trying to accomplish with any client that we work with. The first and foremost being that we must educate the member on a handful of things. So if they don't know about the program, first of all, then there's absolutely no way they're going to be participating in it. So we need to make sure they're understanding what the program is. We need to make sure they know why they're doing certain activities. So how are they attached to some of the risks that they might have, some of the benefits that might come with participating in those activities or a program. And then we want to also educate the member on the existing programs and resources that are available to them. Again, if they don't know about those existing programs that are there, like US Med, Bridge Health, then how are they going to use them? Our second goal is to really drive utilization and engagement within the platform. So this is really the how. So grabbing onto people, getting that hook to get them into the platform and keep them coming back into the platform. And we do this by making the program relevant to each person so that they want to come back. And I'll show you a little bit about how we do that once I get into the demo of the platform. But we really try to ask questions and tie in information from the health assessment so that they are getting that relevant information. So if you think about a typical wellness program, a lot of times they'll have a set of standard activities that they are asking employees to do in order to get rewards or in order to get that benefit of the program. So an example that I like to do is how many people on this webinar like to run, like really enjoy running? I know I can't see any of you, but I've asked that question enough times to know that at least a handful of you are snickering or kind of scoffing at the thought of even running down the block. And there's no way we could even offer enough money to get you to go for a run. So if a wellness program is continually telling you to go for a run or telling you that we're going to have a 5K, we're going to incent you for going up for a run 3 times a week, we're not going to keep you engaged. We're not going to keep you coming back because it's not relevant to you. You have no interest in running. So by asking different questions within the platform, we're really able to drive down into what makes somebody tick and what is going to help get people to do those activities that are going to help impact their health. Because that really is our ultimate goal, is that we want to improve the health of the employees or the members within our system. And this isn't done just through physical activities such as running or healthy eating or that sort of thing, but also through financial activities, relationship activities, personal growth activities, research has shown that by ignoring any of those other areas, it still comes back and impacts our physical health. So if you think about a job transition, so let's say you just lost your job, that has a huge impact financially. That's the most obvious one. Where am I going to get money? How am I going to pay the bills? Am I going to find a new job quickly? Do I have enough saved? There's the stress in that financial area. It's going to impact our relationships. So if I'm stressed out about money, I might be snippy at my spouse because they just went and got their nails done, and that's extra money that we don't have right now. Or I might just be overly sensitive to any little thing that they're doing, and that's going to put our strain on our relationship. My growth bucket is going to be depleted. So I just lost my job. I'm feeling really down. Why did I lose it? Is it because I don't have enough experience, or am I going to be able to live up to another job? Is somebody going to hire me in that area? How can I become better in those professional growth areas? So all of those things have an impact on our physical health, because if they're all weighing on us, we're going to be stressed, we're not going to be sleeping well, maybe we're not going to be eating well because we just don't have the energy to make a good dinner. So within the platform, we target all of those different areas to try to find that balance and give people the information they need where they are in life. Somebody that runs 5 miles every day isn't necessarily the healthiest person because they might be out of balance in these other areas. And then finally, we want to help stabilize those healthcare costs. So Gary gave a perfect example of the telemedicine. So if telemedicine costs about 25% of a doctor's visit, even if we just have 5 people use telemedicine rather than going to the doctor, that's just a very easy example to see where those costs are lower. If people are enrolling in some sort of disease management program or taking the preventative care to prevent catastrophic events, then that's going to have an even bigger impact on those healthcare costs. And then aside from just the healthcare costs, from an employer standpoint, we're going to help stabilize those costs because your employees are going to be more present at work. They're not going to be calling in sick as often. They're going to be more productive. So there's all those other costs associated with somebody being unhealthy that we want to try to counteract. Now, some of the things that you can expect once you get logged into the platform or are starting to get familiar with the platform are a number of communications, both from Allied and from Benovate. If an employee has provided their email address to Allied, then you'll be getting an email from Allied about the platform and encouraging the employee to sign up for the platform, get their account verified. If we don't have an email, then they'll just be getting information within their member packets. And everybody will be getting that information within their member packets, but if they don't have an email, then that's the only way that they'll be getting that information initially. And then we're also doing an outreach call campaign. So some of you might have heard from employees that they've gotten a call from Benovate, and are they really with Allied? We are with Allied, and we are doing this outreach campaign because we just have a small number of email addresses that we can reach out to employees with. So we're trying to really hit at all different angles and get people engaged in different ways, because we know that things don't resonate the same way with every single person. So that call campaign is a good way for us to interact with the members, to answer questions, help people get verified into the system so we can actually walk through and get them verified right there, collect emails so that we can send out a verification link right to the email address. So that call campaign will be an ongoing thing depending on if somebody is verified or not yet. And then the incentives, we will be doing batch distribution of the Amazon.com gift card. So the employee has to earn a minimum amount in order to get that Amazon.com gift card initially. And it will be emailed to whatever address is associated with that platform account. And then for account verification, this is the big thing. So going back to that, first and foremost, getting people hooked to start with. We need to get people verified. So in order to get into the platform, a member has to verify their account in one of two ways. If they provided their email address, then they'll get a link sent directly to their email, and that link is unique to each individual. So if Joe and Sue share an email address, then they'll have to create a second one to have their separate accounts. They can't share the same email address because that's one of the unique identifiers to keep the platform secure. So we can't send the link to somebody else. So that's one way to verify the account. The second way is through member.alliednational.com. And I'll actually go to the page here so you can see what this page looks like if you haven't been there yet. So to register the first time, if you're going this method, would take you to this page. And you see the registration code here. So on each member card, there's a front and a back, and there's a member ID number, and then on the back side, there's a second number that's a registration ID number. And that registration ID number has 4 sections to it. So that's an easy way to kind of distinguish between the member ID. It has 4 sections, and you'll just be using the numbers and the dashes. So no letters or names at the beginning. If you see there's an example down here, it says John and then the number, we would just leave that John off. It would just be the numbers and the dashes in that registration code. And then for birthday, just following this format that's listed in the box here with the year, dash, month, dash, day. And then the other sections are pretty self-explanatory, but those seem to be the two things that we've gotten questions about. And then once we fill in all of these things, we've got security answers, keeping in mind that the answer has to be exactly the same when they come back again. So if you sign up with it being capitalized or having periods, spaces, any of that, it has to be identical when they log back into the system later on and answer that question. So we come here, click verify. It would then take you to an accept the terms and conditions page, accept those, and then it would take the member into the platform. So I'm going to give you a little demonstration of what that platform looks like. And you can get to the sign-in page with that same allied.member.com, member.alliednational.com website. There's a little login button there, and you would just come to this page, sign in. Oops, make sure I get my password right. And then it has a sign-in confirmation. So this is that security question that I was talking about here. And it just gives us a 2-step authentication. So it's basically giving 2 keys to the system. So somebody's information is HIPAA compliant. It's all secure within the system because of these two steps to get in. Similar to a bank account, they ask you 2 different questions, the login or the password and username along with a second question. So that adds that extra layer of security, especially since we have that single sign-on to Allied's website. So here's the platform. We have a few things that I want to point out to you. So first of all, we have these numbers up here at the top. We have our lifetime earned, left to earn. Those are probably the most important to those members as they're earning their incentive. So the left to earn will be $250 to start out with here. And that's how much they can get for logging into the platform, completing activities, doing various things within the platform. And as they do activities, that will go down and that lifetime earned will increase. When somebody first logs into the platform right after that verification, they'll just see a couple of cards, and that will be the walkthrough that Gary mentioned, just explaining what the system is, what points mean, what the incentives are, what the questions mean, all of that, just kind of giving a little demo to somebody. But then once they log in after that initial time, they'll start to see different activities and questions within the platform. So if we see here on this homemade lunch card, these are all called cards, we have a 4. And those are 4 points that are going to translate up into these lifetime points. So I'm going to actually click I saved. So I made my lunch today. Thanks, you earned 40 cents. So up here, these are flashing. We saw that those amounts changed. We'll close that card, and then we'll see that that shifted over. And as we scroll down, we'll see more cards dealing out. We start out with some more simple, basic activities to get people engaged in the platform, make it easy to start earning points and dollars, get to know them a little bit better, and then as time goes on, the activities and questions will get a little bit more in-depth, just since we've gotten to know what they need more so than we do when we initially come into the platform. So when we did that activity, I don't know if you saw up here that this health meter changed. We have these 4 meters up here at the top, and our goal is to find that balance between those 4 pillars. So as I talked about earlier, all of these things have an impact on one's physical health. So as we do activities, those meters are going to change. Now if somebody does a bunch of physical activities, I'll just do another one here, the meters are going to adjust. So we saw our health meter went way down. So this morning I came in here, did some physical activities. I haven't done anything else in the other areas yet. So now this health is in the red. It's saying basically, hey, you haven't done much in the other areas. Why don't you try to find something in one of those other buckets to do today? And if we keep doing those health activities, then eventually they'll fade out to bring even more emphasis on all of the other areas. And they'll come back. So as the day goes on, those meters will change depending on how much you've done. If it's been a while since you've come in, so if I come back at 4 or 5 o'clock tonight, that'll come down a little bit more. So just helping us find that balance. Here we have some question cards. So these are the cards that help with making that program relevant to each person. So do you enjoy dancing? Yes, I enjoy dancing. We'll confirm. And then as we continue moving through the platform, we'll start to see cards related to dancing on there. If I clicked no, I would never see any activities related to dancing because the system knows now I don't like dancing. There's no point in giving me activities to go dance. Okay, so that's kind of how some of those cards work within the system. We're going to continue adding cards as time goes on. The system is going to continually evolve, so you'll start to see videos within the platform. Later on this year, you'll start to see courses become available later on. So it's just going to continue getting more in-depth and better for the user. I know we're starting to run short on time or over time, so I'll try to hurry along. I just want to point out a couple more things over here on the right-hand side. So this is where all of those member links are that Gary was talking about earlier, being able to talk to a doctor, so that telemedicine, self-service login, check your benefits and what's covered under your plan. All of those things are right here. So it's easy for a member to just click on it. Hey, I did a couple activities. I want to check my plan. I want to talk to a doctor. It's all in one place. It's a one-stop shop, so somebody doesn't have to go searching all over the place for the information that they need. Really making it the hub for each user. We also have a personal health desktop tab, and when a user first comes into the system, they'll actually see a card that says take your health assessment, because that's one of the things we really want to make sure people are doing. But if they click on this health assessment or that personal health desktop page, somebody will be taken to their health risk assessment and prompted to complete your health assessment. And by completing the health assessment, that's just going to bring more information into the system. So not only are we learning about likes and dislikes about the person, we're learning about what their risks are or what conditions we can help manage through the platform and through activities within the platform. Okay, so I think that kind of gives a basic overview of the system. If you ever have any questions and you're in the platform, we do have a question button. So if you click that, you can just send us a quick email. We're there to answer questions if you have them. We want to make sure that the system is as user-friendly as possible. So we're there to answer any questions you have or address any needs that you might have. But with that, I think I'll pass it back over to Gary. If you have questions, we will open it up so you can type those into the question box and we'll start answering some of those questions. And this recording will be, or this presentation is recorded, I believe, Gary, correct? So if you have to go.
Yes, we are recording right now. Thank you, Catherine. That was a tremendous demo. So I hope everyone kind of got a feel for what they can expect when they go inside the portal here, and the resources available to you and the ease of use in the system and the rewards that are available to everyone here. So at this point, I know we're running a little longer than what we planned on it. We'd like to open it up for anyone who'd like to ask any questions. We'll do this by using the question feature inside your GoToWebinar control panel that is up on your screen. You'll see a little section for questions, and you can type those questions in here. I've already received a couple of them. I think some of these came in before Catherine explained them, but I'll just kind of repeat a few of the things here. The number one question we get on our phone lines here, and that was typed in just earlier here, is how do I register and get onto the system? And basically the only thing you need really is your health plan ID card, and Catherine showed you the back of that card has your Allied Member Connection ID on it. You provide that from the members.alliednational.com registration page, and it will lead you through the process to register, verify your account, and get you signed in to the system. Another question that comes up quite frequently here, and Catherine addressed it a little bit here, is Allied really making phone calls to everyone? And Benovate is doing that on behalf of Allied. They're introducing themselves as Allied, and they've got two real goals in contacting all of the employees here. One is to help anyone register in the system, to kind of motivate them to do so, and two is to gather email addresses so that we can further communicate with your employees and covered members about the plan benefits. One of the greatest challenges we have as your health plan administrator is helping you promote the benefits of your health plan to your employees, because oftentimes we don't have the contact information for your employees, or there's not often a good time to do that. Email is obviously one of the best ways we can contact and start the education effort for your members, so we're going out and trying to get that. So let everyone know that the information is kept secure. We don't sell email lists or anything like that. This is all about this member connection portal and the education process for it. Received another question about security and privacy concerns, and Catherine touched on it just briefly here. You saw the security for sign-ons, and they create a multi-level sign-on system. You don't just enter your email address and a password. You also have to answer one of those private questions. That's that second layer or multi-level security that's required for HIPAA privacy concerns. But the next level of security is really more of a privacy issue here. Is if you're going into this system and completing health risk assessments and answering questions about your personal health, is that information kept confidential and private? And it absolutely 100% is. None of this information is ever shared with your employer or anyone else other than healthcare professionals associated with the program who will work with the individual members. In fact, some of the first cards you'll be dealt when you're a new registrant in the program is there to kind of educate members and users that yes, this information is confidential, it's private, no one else will ever see it. So security and privacy is really big issues that we want to make sure everyone is comfortable with inside the program. Someone just typed in a question, can we request a copy of the webinar or the recording to share at a staff meeting? Absolutely. It takes us a couple of days to get the recording completed, and there may be some editing we do to get pauses at the beginning out. Everyone who attended the webinar will get an email from us at the email address with which you registered. It will have a link to the webinar. We'll actually post this webinar on our public website, provide you a link to it, and it will stay up for we'll probably leave this up for quite a while because this has been a good webinar with some good questions, and Catherine did an excellent job of demoing the portal for you. So we'll have that out to you along with any questions and answers we've done as well. Another question that someone has asked is, how can I promote the member connection to my covered employees? Let me answer that in a couple of ways. If you go out to the member.alliednational.com page, there is a downloadable flyer that it'd be an excellent flyer to tack up on a company bulletin board in a lunchroom or coffee room, hand out to employees inside of paychecks. That flyer is actually sent out to everyone with their health plan ID card, but we know sometimes that stuff kind of gets passed over. They take the ID card and they don't look at anything else. So it's an excellent flyer with just a brief overview and instructions how to get into the system. The other thing about promotion is something that Benovate is very big on, which is someone in your office being a hero or an advocate for the program. And it's not necessarily handouts, but it's talking about the program and going in and actually using it yourself and sharing what you've done, what you've learned, and what you've earned in the system with the other employees you know who are covered under the plan. The best promotion for anything is always word of mouth. Be an advocate for the program. If you enjoy what you've seen and what you've learned, talk about it to the other members in your plan, and it'll go a long way towards bringing people into the program, getting them engaged, and helping them both use their health plan and hopefully improving their own health as a result. We've gone over quite a bit here, so I'd like to wrap up now and thank everyone for taking time out of their busy days to sit in with us and learn a little bit about the Member Connection program. We'll have the recording off to you within the next couple of days so that you can replay it. And if you have any questions at all, please don't hesitate to contact us here at Allied, client service at alliednational.com. And we appreciate you working with us, and we hope you'll use Member Connection going forward. Thank you very much, everyone.